Terrible. All right, Victor. Let's move to the brand new coronavirus numbers just in from the state. 7,674 new cases over the past 2 days. So we have jumped up now to averaging 3,800 cases a day. That keeps the 7-day average, the moving average, on the rise and close to 100. We've lost 92 more Michiganders to COVID-19.
Meanwhile, nationally, COVID-19 cases are trending downward, but as has been the case during prior surges, the pattern here in Michigan has been different.
Now, add to that the significant increases we've seen in the number of school outbreaks, as we've reported. You have to ask, where does all this seem to be going? Let's bring in Dr. Frank McGeorge. For whatever reason, Doc, it looks like we are not slowing down like much of the rest of the country is.
No, we're not, Devin and Kimberly. I think that's really the headline. Michigan cases are not slowing down. The rate of new cases is not increasing as quickly as they have with prior surges, and essentially the curve is flatter, but without a drop in new cases. In time, the same number of people will end up infected. This is the CDC graph of the 7-day moving average of new cases in the United States since the start of the pandemic. You can see on the far right side, cases in the U.S. have begun to decrease since about the start of September. Now focus your attention to the right of the graph as we switch to new cases in the state of Michigan. You can clearly see that while cases in the U.S. were trending down, in Michigan we are steadily increasing. States like Florida and Texas that saw devastating increases just months ago are falling sharply, while Michigan cases continue to climb. Looking at Michigan's current climb compared to prior surges last winter and this spring, the increase hasn't been as sharp, but it is unquestionably increasing. Hospitalizations are on the rise again as well. Now, all of this is with the backdrop of school back in session and an increase in school outbreaks. Data from the state show that as of the start of this week, there were 373 outbreak investigations in Michigan schools, 95 of which were newly listed this past week. While the majority of the investigations were for 9 or fewer infected staff or students, 70 of the outbreaks involved 10 or more people. The largest ongoing outbreak is at the University of Michigan, involving 506 individuals. In total, there are over 3,000 students and staff in the state involved in these outbreaks. Now, looking at the most recent models for new cases in the state, similar to last week, they are still projecting a plateau or slowing of new cases. But the level of uncertainty actually includes the possibility of continued increases as well. Either way, the models do not strongly suggest that there is any fall in cases in our near future.
Yeah, and Frank, we keep hearing about nursing and provider shortages in hospitals. I suppose the implications are obvious if we don't see a decrease in cases.
Yeah, we're going into this winter with fewer inpatient resources than we had before, and hospitals are already running at high capacity with non-COVID illnesses. Frankly, if we do not see a drop soon or cannot increase our hospital staffing, this is going to be a very difficult winter from a hospital standpoint.
Which is not good. All right, Doc.